Hey, this is O from O's Elite Phlebotomy. Today we're going over the basic blood draw. So in this video, you'll see basic blood work being drawn and from different angles. So right now, we're just going to start off with the basic tying of the tourniquet. As you can see, the first thing to do is cross both ends of the tourniquet and make a bow. We're going to release it and show. As you can see, it is a long end and a short end. The short end is for releasing. It's called quick release. So if you ever see that and you need that when your patient is fainting or your patient is being resistant, you use the short end to release. This is showing a proper measurements of where your tourniquet should be placed. That is 3 inches above. And we measure that by using 3 fingers. Again, we're doing the crisscross applesauce. We take the piece that's on top, the one that's rubbing across the thumb, and we tuck that in, and we're making a kind of a half of a bow, if that makes sense. It's not a full bow, okay? Just take a look at what I mean. So it's going to be a half a bow. One end is going to be short, one end is going to be long. The short is for your quick release. So anything happens, just like that, you can release it. Now I'm showing you how you can palpate to find the veins. We are looking for the 3 main veins, and out of those 3 main veins that we're looking for the one that is the best choice for what we're deciding to do. Using a needle, straight needle or butterfly, or high depth it is, what gauge needle to use. So this is what we're doing when we're palpating. Some people use 1 finger, some people use 2 fingers. It depends on the preference of the phlebotomist. So that's what we're doing at this point. We're releasing the tourniquet again, just to take time to find exactly which vein we're going to. And now we're going to clean it with an alcohol pad. That alcohol pad was dry, so we had to get a new one. Okay, so now that we found a proper alcohol pad, we're going to do counterclockwise. We're going to go small and get large. We're starting exactly where we figured out where we're going to stick the needle, our straight stick at this choice that we chose for that. No fanning, no blowing, none of that. We let air dry. Now that it's air dry, we gather up all our materials. We put all our materials together. This is us putting the straight stick together. This is a 22 gauge. White on white is right. We're opening up everything so we can have everything prepared for the actual venipuncture blood draw. Gauze, tape, Band-Aid, tubes, tourniquet, everything is all at our side. Now look at this. The needle gauge open has to be up, not to the side. It has to be facing you. That is the needle gauge of a 22 needle. We push the elbow up to hyperextend, take our thumb to taunt the skin, 4 fingers behind the elbow to keep it extra hyperextended. Gentle, smooth entry. Boom. Now you're going to see this done again from a different angle. So just stay tuned and pay attention to that. This is from one angle of us getting the blood drawn. This patient blood is coming out a little slow. We're just using this as an example. We don't need to get too much blood at this time because this is just an example. So that's what's happening now. We're taunting the skin, pulling the needle back just a little bit to get the blood to flow faster. It didn't happen in this case, so that's perfectly fine because we're just doing this as an example. Releasing the tourniquet, grabbing the gauze, asking the patient to place their finger there, not yourself. The patient is placing their finger there. While you're doing this, you can take time to clean up your mess. You can take time to, this is just from another angle. Remember, this is just from another angle. The same procedure done, but just from another angle. Just showing you different angles and different views. Showing how we transfer the tube from our wristband into the actual vacuum container. Same procedure, different angle. After so, we label our blood at the point of draw. Not in the hallway, not after we leave. We label it there, clean it up, double check before we put a Band-Aid on our patient because some patients need more gauze, patient care services after getting their blood drawn. A bandage is used with this patient. This patient is okay. Now we're going to dispose of the needle. At this angle right here, we're showing you all the items that was used for this blood draw, and that should be used in each and every blood draw. So again, my name is Onika. I'm from O's Elite Phlebotomy here in Baltimore, Maryland. Check us out.